We operated under the false assumption that when you took ill in New Zealand, you either receive surgery when you need it or you get given a pill when you need it. And we had no idea of the way in which Pharmac operates, about how limited its budget is, about how we are behind in the world when it comes to the funding of modern medicines. So we were absolutely none the wiser, I suppose, just like your average Joe Bloggs. We thought you go to the doctor, and in New Zealand we have first-class healthcare. Our experience to date is that we're third world at best. It's an absolute travesty the way that the Pharmac operates, and I suppose the lack of intervention on the part of politicians.
And how does sort of having to think about money and where the drugs are going to come from, and I know you've had such wonderful support from people, but how does that affect your family and Wiki as you're trying to deal with, I guess, the core issue itself?
Yeah, well, it's a huge burden, to be honest with you. It's not an issue that we should be having to occupy ourselves with. Our focus really should be on the well-being of Wiki and really extending her life for however long we can do that for. But having to worry about having to fund a drug that's unsubsidised, and then I guess subsequent to that, hearing of other stories of people in not only our community but throughout the country who are in a similar predicament, maybe not necessarily in relation to breast cancer, but in relation to other cancers and other diseases and illnesses. I mean, there's a lot of weight on these shoulders. But I suppose the way in which we've responded is to lean on our whānau and our community who have been wonderful in supporting us through this journey, I must say. But as we've gone along that path, more and more people are becoming aware of the shortcomings of Pharmac.
You're in the middle of this fight. What would be your dream outcome?
My dream outcome would be for there to be an independent inquiry. We did everything that was asked of us from the Labour government. We were told that if we had a problem with Pharmac, that we were best to lodge a petition, which is what we did back in October, and that subsequent to that there would be a hearing process through the Health Select Committee. We had been urging the Health Select Committee to hold an independent inquiry. A vote was taken, it was defeated. And then we heard afterwards that the Labour MPs on that select committee were wanting either the Law Commission or Treasury of all entities, and I say that because Treasury absolutely love Pharmac because they save money, that they would be a more appropriate body by which an independent inquiry could be held. We're now at the position where we believe the only independent inquiry that can be held into Pharmac is by a Royal Commission of Inquiry, and I think that's where this fight is going to head. It saddens me that we have to jump through all these hoops, and there are a lot of women in particular through the breast cancer community who have been supporting us through the way who are no longer with us today. And I constantly, when I'm being questioned in particular by media, I have their images flash up in my head, and it's extremely sad and it's bloody hard. But we plod on. So on top of the Royal Commission of an Inquiry, we'd also like to see the Pharmac budget at least doubled, because we know a lot of the decisions that are being made have absolutely nothing to do with whether or not a drug is efficacious. It has everything to do with the fact that Pharmac are operating under an extremely limited budget.
And how's Wiki doing at the moment?
So Wiki's about to have another check-up with her oncologist. At the moment she's in relatively good health, although we suspect that she's going to need a change of treatment probably fairly soon. So the chemotherapy, the Triple M that I spoke about before, is probably coming to the end of its helpfulness, and it's at that point that we'll sit down with the oncologist. He may offer another form of chemotherapy, or it could be Ibrance that Wiki needs to go on. So this is not an easy journey, as I said before. It's one that we have to go through now every month. Before that, it was every 2 months that we were checking in at the hospital. So, the lead up to hospital appointments now is just filled with trepidation and fear.
And you've obviously got some brave kids there, Malcolm. I see Molly Rose has been vocal in the past. I just wonder how they're doing.
They struggle, they have their moments, they have their ups and downs. I think each one of our children has reacted differently. I mean, they're different creatures, they're a little bit unto themselves. Molly Rose, I think, given she's the eldest of our 3 kids, took on a leadership role, probably when she shouldn't have to. And she became frustrated, in particular at the end of last year, when she felt that the process we'd been going through was getting us nowhere. She wrote an open letter to the Prime Minister. The Prime Minister refused to respond, and I think that was very hurtful for Molly because we personally know Jacinda. We knew her before she became the Prime Minister, and we felt that if that Molly of all people would receive a response, but that didn't happen. We got something through one of her spin doctors, and so that in itself I think is very telling.